from Assistant Manager of School of Health and Nursing from MDIS. Yeah, sorry. So I'm here today to talk about nursing careers. Normally nursing careers are usually when we think of nursing careers, we always think of only in the healthcare institutions such as clinics or hospitals. But of course, there's a lot of changes happening in the Singapore healthcare landscape. So I'd like to talk about that and what are the new opportunities you can find. So the reason why this is happening is because, of course, not just so we'll be talking about the changes in Singapore nursing profession, the new scope of practices, the professional growth and upgrading pathways for nurses, and then why you need the degree as well, and the new roles that have been already been formalized as well, such as advanced practice nurse and the community nurse. So during the pandemic, especially during COVID-19, of course, the nursing profession was better recognized during the pandemic as the backbone of the healthcare system. So there were new healthcare challenges highlighted during this period especially. So we saw that suddenly nurses had to deal with very frequent changes in the situation. You needed for timely training. There's a lot of misinformation going on. And then we had to handle public response as well. These are normally not part of the role that we are normally used to handling as well. And you needed to really be able to critically think about how to handle the people and how to actually also reassure them as well. So this is why we also tell nurses you actually do need to continually upgrade yourself and educate yourself, and this is also why you will need a nursing degree, because nowadays especially, this is a quote from Dr. Peter Carter, who is the General Secretary of Royal College of Nursing. Nursing roles are demanding and invoke increasingly advanced levels of practice and critical knowledge. So all nurses need to put quality care at the center of what they do, and they also need extensive knowledge, analytical skills, and experience to work in a range of settings. So when we talk about this range of settings, it's not just only healthcare anymore, in a healthcare institution like a clinic anymore. We're thinking actually a lot wider than that. Sometimes nowadays the whole world is really your oyster. So now let's talk about healthcare in Singapore itself. We now have more complex needs and demands. The patients are sicker, they're getting older, they're collecting a lot more chronic diseases as well and surviving all this. So we have to manage all these things. And nurses themselves also are demanding more opportunities to upskill, upgrade themselves, and get more recognition for what they do. So we are also making more demands also from the system as well, that we want to be recognized for what nursing do, and we want new opportunities also to explore new pathways as well. So in the UK, especially, for example, in 2013, they also suggested that all new nurses should hold a degree level qualification. So with that kind of target, even our government will eventually start to upgrade all our nurses as well. So I'll tell you quite frankly that your nurse managers, all of them, have to get a degree already. If you want to look at management level, you must at least hold a minimum of a degree to get there as well. So for the Singapore healthcare and government, they are also now looking at a different pathway to meet all these needs that are coming up now. We'll have to go back a little bit in history. So I know most nurses don't really look into this kind of background things, but it's important to give you a background of why all these changes are happening as well. So there's two major reviews in the Singapore nursing profession. In 2012, the government set up the National Nursing Task Force, the NNT, which was formed to make recommendations for growth, professional development, and recognition of the nurses. So this task force comprised of 60 nurses across the healthcare systems, and they made about 15 recommendations in career development, autonomy, recognition, and education. So why this was important is because the traditional role of the nurse is to be the handmaiden of the doctors. So basically, the doctor tells you what to do, you do what the doctor tells you. If your nursing sister tells you what to do, you also do what the nursing sister tells you. But of course, this isn't really what we expect our nurses nowadays. We expect you to think more critically, react to the situation at hand. So you have to really be able to think a lot more, so we were demanding a lot more autonomy as well. And then of course, for education-wise, now they formalized they realized that they needed to continually upgrade and train our nurses. So for example, during the COVID pandemic, nurses had to immediately learn how to don on the PPE, the protective gear, how to do the swabs, what are all the processes needed to make sure that your patients are safely isolated, and what to do if you suspect a patient is positive. So the second major review also was in 2016. This time the task force is called the FNCRC. They were formed to identify further areas of transformation. So they came up, their strategy was basically divided into 3 Cs, which is care, to enable nurses to focus more on patient care. So nurses, unfortunately, they have been moving more and more to nursing, what we call nursing the paperwork or nursing the computers. So they wanted nurses to go back and really look at their patients again, and then community. So they wanted to strengthen community nursing and see competency. We want to develop competencies to prepare nurses for the future. So all these will change how we're looking at your career tracks and how you're going to be educated. So this is the traditional career track for nurses. You'll find this, of course, on their MOH website. So generally, the nursing tracks are usually divided into your management. So your management would be like your nursing sister in the ward, your nurse manager who will look after the HR, the hiring, the ward policies and all these. And then, of course, your nurse clinician. So your clinical track is when you specialize in the area of specialty that you are interested in. For example, neurology, diabetes, these are the nursing clinicians. And then you have a new the nursing educator as well. She's also, so the nurse educator also does a lot more in teaching. Of course, the nursing educator you will know very well because these are what your nurse students see every day. So you have nurse educators that are based in the hospitals or your clinics or your healthcare institutions, and then your nursing lecturers also that are based in the schools and would set your tests, exams, and nag you a lot. So if I may be so bold to say, these career tracks are going to be changing a lot more in the future. So apart from these 4 career tracks, the likelihood is that you're going to see things like the community track as well and the informatics track. Unfortunately, these are not all formalized yet, but I'll talk a bit more about the further specialization in the clinical side and the community side as well. Thanks to all these major reviews in the Singapore nursing profession, so they realized that they needed to change a lot more to retain these nurses as well as attract people to the profession. So the Singapore nurses now, they have greater leadership roles and responsibilities. In 2005, they realized that they needed to make the chairman of the Singapore Nursing Board a nurse as well. So traditionally, the chairman has always been a medical doctor. So now they have decided that from now on, 2005, it will always be a nurse. So nowadays, also when we develop healthcare facilities and all these things, nurses are also included in the planning teams, development teams, and projects as well. So commissioning of your new healthcare facilities, and then of course these new nursing career tracks, we will go through it further. And now they also do nurse-led clinics and nursing innovation teams. So now I'll talk a bit more about what are new roles that nurses can consider and look into. So you have your research nurses. So these are the 3 major hospitals also, your restructured hospitals, which is the SGH, NUH, and Tan Tock Seng Hospital. So when I joined as a nursing student at the time, nursing research was not even an actual department. There was only one person who was literally doing nursing research in Tan Tock Seng at that time when I was a student. But then they realized that eventually that research is really important. So now they have set up their own formal departments, and then and nowadays you can also consider to be a nursing researcher. But to be a nursing researcher, I will tell you this because it's not really widely advertised, but most of the nursing researchers must have a degree as well, because you need to know how to run a clinical trial and do your nursing research, your quantitative analysis and everything. So these are the things that your nursing researcher will be doing. So they'll be looking really at the topic areas of research that usually the medical researchers don't really look at, because our medical researchers generally tend to focus on what we call the big picture topics. So the fun ones are like cancer, AIDS, all these things. These are what your medical researcher will look into. Your nurses, unfortunately, will be looking more into the things that they see every day. So things like these are the problems that still exist despite how many years of research and healthcare innovations, such as your pressure wound injuries, your fall risk, and then even how to also tackle our own nursing burnout and how to attract nurses to the role. So these are research areas that are actually a bit neglected, and nurses can actually move into these research roles and actually try to develop new strategies to combat these. So the new roles that aren't even formalized, as you can see, nobody would have thought that nurses wear hard hats and need to build facilities. But as you can see, these 3 help to plan healthcare institutions in Singapore. So from the left is Khoo Teck Puat. This lady also, then the middle lady helped to plan how to build Ng Teng Fong General Hospital, and on the right, this one helped do Sengkang General Hospital. So nurses now are on teams on to how to plan the wards, how the healthcare process, how your new healthcare institution will look like. So I'll move on to the new nursing roles. So this one is only in as of 2017, we now have a community nurse. So nurses are now moving out into the community. They're not just sitting in the hospital anymore. They're not in the clinic anymore. They're going out to the community in the neighborhood. They are going to set up their little neighborhood posts, and they will be there to help manage seniors with the chronic conditions. Yeah. So these community nurses will make home visits, especially to patients. Patients that are usually bedbound or vulnerable, have difficulties coming to the clinic, or maybe also and especially the underprivileged. So for this role, this one requires a different sets of skills that you would normally see in your, different set of skills that you would normally require in a hospital, because now you're looking at how your patient actually really does look like at home. So do they take their medication? Do they take proper care of themselves? If you have a diabetic foot wound, are you really looking after that foot wound? So now the community nurse will go there and actually make sure that they are really looking after their foot wound and not waiting until the foot is really at extreme stage, then coming back to the hospital again. So because of this, that means that you need new nurses and nurse leaders to have the right skills to look after people in the community, to speak to them carefully, and how to manage all these things. So for this, of course, education-wise, we needed to set up a new competency framework for this. So there's community nursing, or it's called CNCF. It was delivered in 2019 to articulate the roles and responsibilities and the competencies required to care for these patients. So these community nurses will manage patient chronic diseases, encourage medication compliance, and do health promotion to the patients. So I'll talk a bit more about the new role as well here, the advanced practice nurse. This is also quite a new role that, but I think a lot of us have not been actually explained what advanced practice nurse do. So in 2005, Singapore actually introduced the role of advanced practice nurse in 2005. The first batch of APNs were actually certified only in 2007. So this one, for advanced practice nurse, this is where you go further in your clinical track. Most nurses do not, so usually clinical nurses will specialize in their discipline of choice, such as a medical, surgical, operating theatre. It can be palliative as well, it can be neuro, it can be oncology. So the advanced practice nurse is a registered nurse who has acquired expert knowledge base, complex decision skills, and clinical competencies of extended practice. They are trained in diagnosis and management of common medical conditions, including chronic illnesses. So for short, APNs are expected to use advanced assessment and critical skills to anticipate and manage complex situations. So they can administer therapies now and manage actual and potential health issues. They usually follow the doctors round. They will join the doctors in looking after the patient and managing the patient as well. So you will see APNs in Singapore especially, they are sometimes they are now leading clinics as well. So where you used to only see the doctor, some of you will now see the APN instead to help manage your condition. So in 2019, they decided to give more responsibilities to advanced practice nurse. So advanced practice nurses are now given collaborative prescribing rights. So APNs are senior pharmacists who have been credentialed by their institutions can now prescribe medications for their patients. So this is to also help cut down the doctor's workload. They will see patients who have common chronic conditions, and then they will always look forward. So they will often see these patients more often also in the clinic to try and keep their condition under control. So we've come to the end of the formal job scopes. So one of the things that we don't have a formal description of is probably the informatics nurse. So the informatics nurse is, in a sense, your IT nurse. Nowadays, your healthcare institution can't run away from IT or information technology. Yeah, so unfortunately, there isn't a real job role for this yet. But I can tell you that they all exist actually in all your institutions. It's just that we don't give them a formal name or role yet. So the informatics nurse right now is probably the one that's in charge of your medical records. So of course your IT medical records are now being shared across all the hospitals, so that it doesn't matter which hospital we go to, whether it's Sengkang or whether it's SGH or even Tan Tock Seng, even when they're different groups, the IT side will make sure that eventually their patient records are all retrievable across the island. Of course, it's also important that they've also made sure there's innovations as well. So in how to monitor your patients, so your patient's blood pressure, breathing, heart rate, all these things, these are all now being monitored by machines. And then of course they all have to be combined together to form a trend. So for this, the IT nurse is really deeply involved in all these things, and we will likely train a lot more of them. So as of this year, I'll tell you that usually the restructured hospitals are all planning to also change their medical systems. So for those who are already working in hospitals, you've probably undergone a lot of training already in the new medical documentation system. So your IT nurse is definitely in the thick of things, and you will likely need more of these nurses as well. So after going through all these career tracks, I just wanted to add that the degree is just really a launching pad of what you want to do in the future. So you need to also kind of strategize what is your future career plan. Even though you're just a nurse, it doesn't mean that you're only stuck in a hospital. You can think further and then even in a sense design the job that you're interested in. If you have interest in, for example, travel, then maybe what you want to do is medical evacuation. Maybe if you're interested in IT, you're going to be the new informatics nurse, and maybe you're the one who's going to design your own job description in the future. So I'll be handing over this talk later to my colleagues, Amruta and Dr. Tam. They will be explaining a lot more about our nursing degree with Edinburgh Napier University. I thank you for your time, and I'd like to add on to show you the video of our Nurses Day. And thank you to all nurses who are still working today looking after us.
I would sum up my experience at MDIS by saying it was euphoric and has taught me to tackle the complex challenges in the field of healthcare. My knowledge in healthcare management had an exponential learning curve and had enabled me to focus on broader goals of minimizing the disease and addressing the inequities to provide a holistic and value-added healthcare to make a difference.
So I worked at Acute General Hospital and Stroke Department for 9 years before coming to MDIS to explore education for nurses and healthcare professionals. It's really important to keep abreast of the times, and healthcare is always changing, and we have to always upgrade as well. So at MDIS School of Health and Nursing, we are here to equip students with the skills to think critically and perform effectively.